Arnold, who's a professor of kinesiology, who will use the hormone affection.
So I also want to keep this very, I think you've had a chance to look at Michael's background and resume. So without elaborating on that, he comes to us from the University of South Carolina, where he's an associate professor in the Department of Exercise and Sports Science in the School of Public Health. I just want to say on a personal note, you'll see that he's got an abundance of energy. What I remember most about Michael is the following. About 11 years ago, I was in the hospital for the first time. I woke up from a major surgery, and I see this guy smiling face at me, and just his kind heart, encouraging words right away. When are we going to get up and do a walk and talk or whatever, and just really kind of getting me going. And that sort of tells me a lot about Michael and his character. So that's my brief introduction to Michael, and I'm going to turn it over to him.
Thank you very much, Brad. And thank you, everybody, for coming here today. I know that you all have busy schedules, and I see a lot of old faces, a lot of new faces in the room. And it's great. It's wonderful. And, you know, I was here for 5 years, from 03 to 08, and it was one of the best times of my life. And so it means a lot for me to come back here and for you to invite me. So thank you. I'm not going to get all teary-eyed here. But I am going to start my timer so I stay on time here. So what I'm going to talk to you today is some work that I've been doing over the last couple years, and I'm really going to share kind of an overview of what I hope to get funded next week from the NIH to actually do. And so if any of you are on any review panels that might be reviewing my grant, I'm just putting that out there that I'd love for any kind of leg up in the process. So my title of my talk is What's Up with Summer? Is Summertime Undermining Obesity Preventions During the School Year? But before I get into this, and what I learned early on in my career, both as a student and as a young professional, is that you're only as good as the people you surround yourself with. And so you may notice some names up there, may be familiar with them, but these are all my friends and colleagues, staff, students, and mentors. And this, I could actually have about 10 slides of this. I tried to condense it down for the time being, but all of these people make me who I am today and help me with my work. And so I'm not here today alone. I'm standing on their shoulders. And then also, we have a number of existing projects in my lab, and I'm not going to talk about these today, but I wanted to share them because they may be things that spark interest in you, and we can have some dialogue about them later. I also have some projects that are pending that are going to be reviewed in the next 2 weeks, but I'd be more than happy to talk about these as well. And based upon these last few slides, when Brad asked me what I wanted to talk about here today, it took me a while to kind of figure out which of the projects that I wanted to talk about. So I'm going to focus on summer and where I think childhood obesity efforts need to go. So this is going to be probably standard fare for those of you in the room about childhood obesity and the trends that we see over time. And so what we see is that obesity has upticked, and this is obesity. This is not overweight and obesity. This is just obesity rates. Has swung up here since the early 60s all the way up to 2002, 07, 08, where this data cuts off, but we can see that there's been a nice upward swing in something that we don't want to happen. More recent data shows obesity rates from 99 to 2013-14. They've gone up, but then we're kind of plateauing here, okay? But we really haven't made much dent in the effort, except for maybe stabilizing the issue at best. And that we also know that there are disparities among racial ethnic groups, and that those that are most afflicted by obesity are the African Americans and those of Latino origin in comparison to white non-Hispanics. And so all this is standard data that comes off the CDC. So this is shaping the issue here in terms of overweight and obesity. And so what have we done from a public health side in order to address this problem? Well, not surprisingly, almost all of our efforts have focused on the schools, and for a very good reason. About 91% of kids in the United States, K through 12, attend public schools, and if you add in private schools, that actually goes up to about 97%. And the remainders are in homeschool or they're not going to school, unfortunately. And so schools have become the primary target for how we're going to address childhood obesity. And one of the more recent, this is actually 2013, more recent systematic reviews and quantitative meta-analyses of childhood obesity prevention efforts, they resulted in that we've been mildly effective in addressing BMI. Okay? And this is off of, when we look here, this is actually off of 32 studies with about 52,000 kids represented. And that standardized mean difference, that effect size here, is pretty tiny when we think about our preventative efforts that have gone into schools. And so while we have been mildly effective, we haven't been overly effective. And at least we've been able to stabilize, if we can attribute the stabilization of our obesity trends to perhaps this type of, these effects that we're seeing here in terms of changes in weight status. But when we look at the data, I think that we have other things that are going on here apart from just being mildly effective, and why our efforts, which at times can be fairly intensive, fairly resource intensive as well, in terms of pouring things into schools in order to make them more effective in terms of reducing overweight and obesity. And here's a good example of why I think we might not be as effective as we would like to be. This comes from the group. This was a large-scale group randomized controlled trial. It was in multiple settings. It was middle schoolers over 3 years. This is New England Journal of Medicine. This is their primary outcome paper. And what these individuals found is that they were able to decrease BMI at the 85th percentile and above across the 3 years in these middle schoolers. They were also able to decrease obesity at the 95th percentile and above. And that waist circumference, well, we need a referent group to really look at what's going on with the waist circumference. This is the treatment group. When we look at what was happening with the control group, these are the kids attending schools that are not getting an intervention. We see that we have this really nice decrease as well that's occurring here, as well as here, and then their waist circumferences are almost tracking dead on. Okay? They're not the only example. So we have a study here by Chris Economos. She's at Tufts. This is Shape Up Somerville 2-year results. This is a non-randomized school-based obesity intervention over 2 years. And they collected BMI data at entry of school, fall, exit of school, spring, entry of school the next year, and then subsequently fall or exit of school. And what they found is that for the intervention group, we see these nice decreases. But we also see either a stability in BMI. This is BMI Z-score, so this is just the percentile changed into a standardized score. That we see that they're either slightly declining or they're maintaining in terms of, and those are the control schools, the kids attending schools that are not receiving an intervention in comparison to kids in schools that are receiving a fairly intense intervention, right? Same pattern that we were seeing almost with the healthy study. So some of the things that we can take away from this literature is that schools are the primary location for which we intervene, and rightfully so. Most kids are attending there. But what the literature would say is that kids are benefiting from being in school with and without an intervention in terms of their weight status. Okay? That's a really important takeaway here. And that's probably why we're seeing minimal effects in terms of our obesity interventions, is because we're comparing it to an intervention already, which is school in and of itself. And so herein lies the issue of, well, why aren't we, if school is such a great effect in terms of either maintaining my weight status or it might be reducing my weight status like we saw in the healthy study, how come we don't see declines in these obesity rates? And I would say that we're missing something here that's very fundamental. And the landmark study that actually shed some light on this was 2007, Paul von Hippel published study off of the early childhood longitudinal cohort study, the ESLSK. And this was about 5,400 kids, kindergarten through the end of first grade, and they happened to have measured BMI in this sample at the beginning and end of each year. And what they found is that here is the change in body mass index that is occurring during the school year. So you have kindergarten here and first grade. But when we look at what's happening during the summertime, we have these first time that this has really been published on. Here comes a 2016 article. This is from a group in Baylor and also at the University of Houston, who happened to have had a school district that was collecting BMI data at the beginning and end of each school year for their kid from kindergarten up through 5th grade. And what they found is that when you plot these things out, you see that during the summer we have increases in the percent of children that are obese or obese and overweight, and during school year that prevalence rate decreases. So here we're shedding some light on the fact that we're having decreases that are going during schools, and these are schools that are not intervened on. This is just school as standard practice. And that we have these upticks that are occurring during the summer, and at times quite excessively. And that with this stair step, we have this continuation, and we're continuing to increase in the prevalence. Okay, so any gains that we're making during the summer, they're lost during, or any gains that we're making during the school year, they're lost during the summer. And we can also look at the same data in terms of BMI, changes in BMI Z-scores, and we see that a 0 change would mean that you're stabilized between summer and school, and we see that during summer we have upticks, we decrease during the school year, and we have this, what I would consider the Charlie Brown pattern. Right? And so over time, we're seeing that some of our obesity prevention efforts during school are going to be completely erased from kids being released to summer. And so when we revisit Shape Up Somerville, which I showed you before, so here's their graph, but they also showed this. And so they're experiencing the same thing within their data, where they have these effects that are occurring during school year in a beneficial way for weight status that are erased during summertime. And it's happening in both of the groups, both the controls and the intervention groups. And so let's come full circle here, and Paul von Hippel happened to have just published in late 2016 another study from the ECLSK cohort, which is from 2010-2011 where it started. And this is 18,000 kids across the U.S. And he shows that mean BMI gains are occurring over time, but the slope is much greater during the summer. And when we look at the prevalence of overweight and obesity, it is growing larger during the summer. It decreases during school year. It goes up again during the summer, and it goes down again during school. So here we have an accumulating body of evidence that is suggesting that when kids are released to summertime, it's a highly toxic environment, at least as in terms for weight gain. Okay? And there are differences among racial ethnic groups. And so we see that Hispanics and Asians actually have higher amounts of weight gain. So this is the change in body mass index, age, sex specific percentiles. We have greater gains during the summer, and these black bars are actually below, meaning that they're losing weight during the school year. And I think that this is probably the most important figure out of all of this data that's been published, is that those that are actually benefiting the most from the school year are those that are already overweight and obese. So those kids that are already overweight and obese appear to be benefiting at greater extents with these with this change of a negative, meaning that they're losing weight, they're improving their weight status during the school year. You release them back to summer, and they gain it back. Okay? Very important. But BMI is not the only thing that's changing. We also have a few studies that happen to have done the same types of serial assessments before and beginning and end of the school year on cardiorespiratory fitness. This comes from Jen Salas's Spark paper that was published back in 1997, and this is mile, run, walk time. So you want to actually have a lower time, okay? So going down is better, okay? And we see that we have during the school year they go down, they lose fitness as during the summertime by the increase in their time, and then they go back down again during the school year. So not only are kids gaining accelerated amounts of weight, but they're also losing cardiorespiratory fitness during the summer. And for those of you that may be familiar with the educational literature, we also have a very similar phenomenon happening with academics, where we call it the achievement gap, where we have kids that are released that are in low-income houses. When they're released to the summer, they lose some of their academic gains that occurred during the school year, so that when they come back to school in the subsequent fall, they are at a lower level than where they left in the spring. Okay? And I would contend that we're seeing the same phenomenon with overweight and obesity and cardiorespiratory fitness. So kids are having this double jeopardy of when they're released to summer, not only are they experiencing academic losses, but they're also experiencing health losses as well. And so this leads me to, so what's up with summer? Okay, it is my favorite coin title of any of my projects. UP stands for Undermining Prevention. So what is up with summer? Why are we seeing this stuff? Well, I think that we can point the finger at 4 obesogenic behaviors. This is physical activity, diet and nutrition, sedentary screen time, and sleep. And I lump sedentary screen time because sometimes you just, you're on your screen device. It's likely that you're sitting, right? So those are important ones for any age group, okay, let alone children. But also for children, we also are interested in parenting behaviors, what the home environment is providing, maybe in terms of food, and then also where are kids finding themselves during summer. I think we probably know where our own kids might be during the summer, but I don't think that we really know where kids largely are during the summertime. And so, importantly, with all this, we really don't know how these behaviors differ between when kids are in school and what happens when we release them to the summer. Well, here's a part of my summary statement on the first time I submitted this grant, and this is a little bit of a professional development moment here. There's 2 points I want to make. First of all, the reviewer says, well, presumably we already know what we're going to find. Professional development point 1, never use the word presumably when you're evaluating scientific evidence, okay? You can hypothesize, but presumably is probably not the word of choice. Second of all, as with any reviewer comments, whether they're for a grant or for a publication, that sometimes you got to read between the lines, all right? And so what I really think that this reviewer is telling me is that they are actually a Home Alone fan, and that Home Alone is a great example of what happens when you release a kid into a highly autonomous environment and what they're actually, the behaviors that they're going to engage in, which I think is going to mimic what summer is like, okay? Now, granted, I know you're going to say, well, this is an N of 1, and it was holiday break. But I think there might be some parallels here that we can draw on. And in fact, these kids are just begging us to figure it out, okay? Come and assess all this stuff, all right? I'm just eating junk and watching rubbish. You better come and stop me. But I got to contend that I think that it's a little bit more complex than that, all right? And so if we kind of rudimentary, and forgive me if you can't read all of these, but I think that there is a lot of stuff going on with all these obesogenic behaviors and how they interact and stuff. And so I don't think it's as simple as kids just go off to summer and they're less active, they sleep less, they eat worse, and they watch more screen time. I just don't think that that's what's happening. And so if we go all the way back again and revisit Paul von Hippel's work, well, he concludes that, you know what, we really don't have any idea what kids are doing during the summertime because nobody's collected this information and compared it to what the same kids are doing during the school year. And so this is a ripe area for investigation, that we simply don't know what kids are doing during the summertime. All we do know is they come back less healthy, but we have no idea what's really going on. But I can hypothesize that, yes, I think it seems logical that kids are less active, that they spend more time during the summer sedentary. They might sleep less, or they might have sleep displacement where they're going to bed later and they're waking up later, which influences the things that they could be doing, but their total sleep time stays the same. And they're probably eating a lot more junk food. Okay? I think that those are fair hypotheses to test. So what do we know from some of the literature that's tried to test this out? Well, this is a really interesting study. They largely rely on self-reports, but here they broke it up between high income, low income, and I'm sorry I'm not showing you what the x-axis is. It's because they transformed it into something really weird, and so I think it's just easier just to focus on the size of the bar, okay? And so what they're showing is that maybe lower income kids are a little bit more active than what you would have seen during the school year, and that there really doesn't seem to be much in terms of vegetable consumption. And for sugar-sweetened beverages, added sugar, TV, and calories, it all seems to be like it's fairly similar. There's not these huge differences which we could point our finger to, hey, that's one of the culprits here, all right? Here's another study by Schmitz. They had self-reported weekday and weekend during the school and during the summertime TV viewing. And what they show is that we see a little bit lower TV viewing during a weekday during the school than what we saw on the weekend during the school year. And that summer seems to mimic more the weekend than it does the weekday during the school. Okay? So there might be some suggestion that kids are watching more TV during the summer. This is actually a really nice study from Tim Olds, who shows a time course of the percentage of children engaged in screen time. The line represents school days. The red, yellow-filled area represents during non-school days, or holidays is what he calls them. So it doesn't necessarily capture summer. But he shows, and for, quite obviously, that when kids are in school, they have less screen time engagement, but that their behavioral patterns mimic each other when school is not present. Okay? And that's depicted right here and also here at this beginning. All right? But school comes in, I reduce screen time. Screen time is elevated when I have more of a discretionary, autonomous environment to choose that. And a final study looked at dietary intake. And here they have, this is in adolescents, and they show that fruit and vegetable intake at school is about 8.5 number of fruits and vegetables consumed during the past 7 days, and during summer it's a little bit less, which would suggest that there's some dietary issues going on there, that kids are eating less fruits and vegetables. They're not reporting anything else about what they ate, but at least the fruit and vegetables are decreased. So what's the takeaway from this literature? Well, one of the main issues here is that these are studies that are between participant designs. So I have a group of kids that I measured during the school year, and I have a different group of kids that demographically look the same, but they're measured during the summertime. So we don't have the same kids measured in those two different settings. Okay, so demographically, we can all look the same. Behaviorally, we might look very different. All right, so that's one of the big issues. And then also, our obesogenic behaviors are not all captured. So yes, the fruit and vegetable differences, but what about the other ones that are really important? Okay, so it's not just fruit and vegetable differences that are happening between school and summer, but there might be other things going on. And then finally, we got to ask ourselves, well, was summer really captured? And in fact, the article that I showed you with the colored graphs, they even say, we can't even really distinguish these breaks from summer break. And by the way, our past 30-day recall probably overlaps some of those segments. So if I recalled in middle of June, I'm recalling for part of June and part of the school year. And by the way, I'm doing that probably consecutively throughout any time in the school year where you might have been captured and a holiday break might have been introduced. And so that makes it really difficult to tease out, are there any differences there, and have you really captured the distinct attributes of those behaviors during a summer vacation? But we can ask ourselves, well, what might mimic a summer environment? So in absence of any real literature on this, what might mimic a summer environment? Well, my doctoral student, Keith Brazendale, who is absolutely phenomenal, he's actually his first paper, and we call this the structured days hypothesis, where we think that school has these compulsory and restrictive elements to it that reinforce healthy behaviors and mitigate engagement in unhealthy behaviors. Right? And we think that weekend days maybe are like a summertime, because on the weekends, some kids, so school is gone, and weekends we have more discretion to engage in the behaviors that we want, to a relative extent, but I think we're more autonomous during the weekends than we are during the weekdays at school. Okay? And what we've done is we've reviewed the literature for studies on elementary age kids that have reported weekday and weekend data, and either have made some type of statistical comparison, or at least illustrate those two separately, whether or not they actually can do a statistical test. We found 177 articles across all 4 of our obesogenic behaviors, and the bolded numbers are actually the U.S. studies, and we have a lot more international studies, but hands down, if we look at the U.S. studies, 27 out of the 29 are in the direction that we would hypothesize of this a less structured environment elicits unhealthy behaviors versus the structured school days. So we think that that might provide us with some hypothesis generating about what are the mechanisms that are going on there, about why is a school protective, and when we release kids into a more autonomous environment, what's actually occurring. So this leads me to the What's Up with Summer study design, and here's what I'm proposing to do, and as I said before, it gets reviewed next Thursday, so keep your fingers crossed, please. So what we're trying to do is we're trying to answer this question about, okay, so how do these behaviors change between summer and school over time within the same child, right? Important component, same children tracked across time. And then also, I'm really interested in, so are parents changing their behaviors, their parenting-related practices between school and summer? So maybe parents just become more lax, and it's really not a, that's what's facilitating more of this autonomous environment. I'm not as restrictive with bedtimes. Sure, let's go and have a treat and stuff. It's summertime, it's fun, right? Oh yeah, sure, let's go see a movie or something like that. I also want to know, well, where are children really going during the summer? We really don't have any evidence about where kids are going during the summer. I think that we can have some hypotheses, but we don't have any solid data as to where do the majority of kids, and particularly kids from low-income households, where are they going? And then I am thinking, and again, this is all subject to being informed by the data, but I think that maybe school is simply just one 9-month interval, and that subsequently summer is just one long weekend. That's my hypothesis about what's going on. Summer mimics a weekend day during the school year, and that you just happen to have that day after day after day for the 10 or 12-week summertime. And so that compounds that effect where it's kind of washed out because it's only 2 out of the 7 days during the 180-day school year. And so what we propose to do is we have a longitudinal cohort design where we have 2 groups. And in South Carolina, we have high income and low income, and that happens to track at a correlation of 0.87 with free and reduced lunch between whites and blacks. Okay, so when we talk about low income individuals in South Carolina, it's largely an African American community, and when you talk about high income, it's a largely white, non-Hispanic community. And we're going to have 2 cohorts that go on. They start at 1st and 2nd grade, and we'll follow them through 3rd and 4th grade. And we will collect the obesogenic behaviors during school and summer consecutively over time. And we will begin to be able to understand not only the difference within a school year, but then also differences in these things as children get older. Because maybe they have a lot more autonomy as they get older, which means that during summer, it might actually be less healthy or more detrimental to their weight status. And so we're also going to be measuring our primary outcomes at the beginning and end of school year every year as they're in the cohort. So we'll be able to get within school year changes by the beginning and end of school year, and we'll be able to get summer changes by the end of school year and the start of the next year. Right? So we'll be able to track all of that information, both cardiorespiratory fitness and BMI. And these are common assessments that are done in fitness grams that schools are already doing. They just happen to only collect it once a year, if they collect it at all. So just asking, and we'll go in and help the schools collect this information as well. But we're also going to be collecting a lot of information about parents. So I have this graphic design student that works in my group, and she makes up all of our questionnaires and stuff so that people actually want to fill them out. And so we have this battery of assessments that relate to parenting practices, perceptions of neighborhood, the home food environment, all this stuff. And I hypothesize that the home is not changing at all. I think the home is the same during the school year as it is during the summertime. And what's changing is the removal of that structured school environment. That's where my thinking is now. It's all subject to change. And then we also have them during our assessments, 10-day assessments at school in summer, we'll have them fill out a daily diary where we get to know, okay, what time did your child go to sleep? What time did they wake up? What other things are they doing? So we'll be able to capture a whole host of information and be able to begin to understand some of the salient differences between these two time points, summer and school. And so if you could conceptualize it in a structural equation model, which I don't know if Alan is here. I really put this in there for Alan. That we could kind of conceptualize it that, you know, and this is not the model to be tested, but it could be fairly close to it about what's going on between the interactions among these behaviors. And yes, I don't have sleep in here, but sleep would be one of the other boxes, and how it influences changes in BMI Z-scores during the school year versus during the summer, and then how are these things related across time. And so there'd be a really nice, rich understanding of what's going on with these kids' obesogenic behaviors. And so what I think that we're ultimately going to see is that we're going to see a reverse of the achievement gap, but now it's a health gap. And what I think we're going to see is that for the high-income kids and low-income kids, I think they're going to have the same slope or the same rate of change during the school year in their health behavior, in their obesogenic, their BMI scores, and that I hypothesize that those kids from low-income households are actually going to have a greater amount of change during the summertime. And so that there is a protective element in high-income households during the summertime to excessive weight gains. It's not that they're not going to have excessive weight gains, it's that it's not going to be to the degree that we might see in low-income households. Right? And that over time, this effect is going to compound to where we have greater and greater spreading of the gap. And I believe that that's what's occurring, and that's why we see higher rates of overweight and obesity in our racial ethnic groups, Hispanics and African Americans. And so this would be a mirror image of what we're seeing with this achievement gap here. And so as part of my doctoral students, when they come into my lab and they work for me, all of their projects are related to collecting pilot data for our preliminary studies for our grants that we submit. And so my student Keith Brazendale was voluntold that he has to do the what's up. And he's been very gracious in the process, but he's really taken it on as his own. And his project was to say that we could actually go out and collect this data. And so we recruited 50 child-parent dyads from a single elementary school that was 95% free and reduced lunch, almost entirely African American, in one of our neighboring neighborhoods. And each participant received $50 for school assessments and $50 for summer. We pay them cash. And so they got $50 for being part of our school, and then we gave them $50 if they completed all of our summer assessments. Here's kind of a timeline that we did. So we recruited, did our assessments here before and after the school year, the bookends of summer. We did our 9-day measurement protocol during the school, and then kids were released to their 9 days during the summertime, and we picked them up about July. We also had some real interesting ways of trying to recruit and not recruit, but to retain for the summer. So what we did is we threw barbecues at the school. So this is the front of the school. And we rented a tent and chairs. We have a barbecue grill back there. We have families come in. We say, we'll feed whoever you bring, but we at least want you to bring you and your child, and we'll give you our surveys, and we have our accelerometers here that we put on the wrist so we can measure sleep as well, and we've developed cut points to distill that into intensity levels for physical activity. And we'll feed you. You could bring 50 people. We have enough food, but we want you to come because that's really the crux of all this. If we can't assess them during the summer, all bets are off with our ability to make any inferences. And so we actually recruited 55 parent-child dyads. We had some loss to just devices, so it's not intentional loss. We lost some of their data because of faulty equipment. And then when we went back to the summertime, well, we had one child that we knew that had recruited during the school, but they were going to spend the summer with somebody outside of Columbia. And so we're like, okay, so that's a loss in and of itself. But we actually had 52 of the 55. We had 16 non-respondents. We're texting these parents We're emailing them. They actually prefer texting, so we're blasting them with text. Hey, by the way, our barbecue is going to happen tomorrow. It's from 4 o'clock to 8 o'clock. Bring whoever you want. Come by, pick up your stuff, and you get cash. We had 16 non-respondents for our summer protocol. Some of those were because we had parents move out, but we also had some devices that were also broken, which we had a final sample with complete summer and school data of 30. So I'm happy with that. It's not a total loss. I'm happy with that. And in fact, when we interviewed those that didn't come back, they said, if you gave us more cash, well, we would have showed up. And I said, okay, well, it's not my money. It's your taxpayer money. Oh, yeah, I'll pay you more to come back. And so we're paying them $150 to come for the summertime assessments now. And we think that that's going to incentivize them so that we get more people in there. And so when we look at responders and non-responders for school data, we don't see any differences between school-age stuff, apart from the sleep diaries that the parents reported, which it's a minimal, trivial, it's 20 minutes. And so we feel fairly confident that we don't have any attrition bias, that those that are not coming during the summertime are fundamentally different in their behaviors during the school year. And so we ended up having, they're roughly 8 years old. The majority of them are African American. In fact, all of them were. And you can see their weight classifications. But I think what's important here is the demographics of the families. And so the primary respondent, not surprisingly, was the mother. But the majority of them were making less than $20,000. Most of them were single and never married. And the majority of them had 4 or more people living in their household, and also had 3 or more kids living in that house as well. And so these are the specific individuals that we want to target with this. Okay, so we are very happy that, hey, we can recruit these individuals, and these are the ones that have the health disparities that are associated that we want to target and know a little bit more about. And so while we have a lot of data, and I'm not going to show this to you, but I'm going to show this one. What we've done is we've distilled these into what we're calling the Health Behavior Index. And we've divided up our behaviors by moderate to vigorous physical activity, sedentary, screen time, sleep, unhealthy foods, and healthy foods and unhealthy foods. Okay? And that's where we're settling now. It could be subject to change. But what we're showing here is that a green means that you actually were better in that behavior during the summertime compared to school. Okay? Red means that your behavior is worse during the summertime compared to school. The yellow represents those kids that both had an increase in their BMI as well as a decrease in cardiorespiratory fitness. So that was half of our sample increased their weight and they decreased their cardiorespiratory fitness. And the other group, which we're calling just the other group, they either gained weight and they improved in cardiorespiratory fitness, or a mix of those things, right? And we only had 2 kids that actually lost weight and improved their fitness. Okay, so we can't make many inferences off this. And I realize that this is small sample stuff, but this helps us to help generate some hypotheses. And what we're showing here is that for our Health Behavior Index, for those kids that lost both fitness and increased their BMI, they only changed, on average, 1.8, or a median of 1 of the 6 health behaviors changed during the summertime in a positive way. Whereas for those kids that are going off that are actually they're either improving their BMI, or they're having changes in cardiorespiratory fitness that are beneficial, they're having 3 of their health behaviors changing out of the 6 in a positive way to the summer. So they're halfway responding positively to the summer, whereas those that are losing fitness and gaining weight are also that are only improving 1 behavior out of the 6 during the summer. And importantly, what you can see from this is that it's not a consistent pattern. And I think that's important, because I could have really great increases in moderate to vigorous physical activity that are completely offset and undermined by decreases or the wrong change in the direction of the other health behaviors. And so I think that what we'll end up seeing from this larger study is that the pattern of effects is not consistent for every kid. And that some improve their sleep, some improve their diet, some of them might improve half of them, but they're offset by the other half. And so I really think that it's a much more complex kind of process that's going on versus just saying, well, all kids are changing negatively in these behaviors in and of themselves. Okay? And so I always like to use this, so what? It was a question that was given to me firstly by Becky Donatel, who is my first advisor here, who whenever I went to her and talked about my harebrained ideas, she always said, well, so what? What's the big deal about that? You know, and I actually think if you can't have a response to that, then you might as well start rethinking your idea. And so I actually use this, and my students hate it when I actually say this now. So what? What's the big deal? And so what? Well, as I said before, I think we're going to have some unforeseen interactions here, that these things are going to change in a very dynamic way, that some of them might nullify or interact with other detrimental changes. So I think we're going to see some really interesting patterns come out here as to what are some of the etiology behind these excessive weight gains and loss of cardiorespiratory fitness. I also think that we really don't know where kids are going. And this is maybe some of the more interesting ones, apart from just, this is purely descriptive. But if we are to do some type of interventions, well, we need to know what are the settings, who are the adults that they interact with, so we can have more planned, targeted approaches rather than just kind of doing this buckshot approach. And so we need to, and I would think that because children are not in this nice one setting like they are in school, we're probably going to have multi-level, multi-setting kind of interventions that are occurring during the summertime to help mitigate some of this excessive weight gain. And lastly, changes over time. We know that kids are changing rapidly as they age in terms of their health behaviors. And so it's going to be really critical to see, well, where kids start out and their negative changes during one summer, maybe they don't necessarily translate to negative changes in subsequent summers and vice versa. And that we're going to have a subset of kids that actually positively respond to summer. Okay? And we had 2 in our sample already. And if we extrapolate that out in terms of 500 kids, we might have a nice subgroup that actually respond positively during the summer. And so it'll be really neat to see what those kids are doing. And so in total, I think that if we don't have this information, we're likely to have our intervention approaches are going to be misguided and waste a lot of valuable resources and time. And so it's critical that we have this type of information to help understand what's really taking place during the summer so that we can have more planned, targeted approaches. And so in conclusion, I would say that summer, at least based on the evidence that I presented today, appears to be fairly convincing that it is undermining all of our obesity prevention efforts that are occurring during the school year. And so unless we begin to figure out what's occurring during the summer, I think that our ability to make any kind of perceivable dent in childhood obesity levels is going to be lost because we're pouring all of our resources into environments that are already interventions in and of themselves in eliciting healthy behaviors. So with that, I want to thank everybody, and I'm happy to take any questions. This is my family. So this is Oliver, my son. He's 5½. Here is my daughter, Adelaide. She's going to turn 2 here in April. And my beautiful wife, Violet, who some of you know. Right here. Yes?
I really liked your presentation. That was really great. I had a quick question about the difference between, or if you think there might be one between year-round schools and schools that follow the traditional calendar, because following the achievement gap sort of idea, schools posit that in the year-round calendar, they don't see as much of a gap because it's a shorter break in the summer, and so maybe it's not just a weekend, but it's the length of the.
Yes, and I'm going to agree with you. So the question was, would going to a year-round school year mitigate this? And it's not that we go to school more, it's just that we break up our breaks. So we're still 180 days, but we go like a 60-20. 60 on, 20 off, 60 on, 20 off. I would say that if we did that across the United States in 3 or 4 years, we would have a marked decrease in childhood obesity. Simply because of that. Because I think that school in and of itself is a very powerful intervention, and it's illustrated by these studies that show that even the control groups are benefiting from being in schools. and that all of our increases in the prevalence of overweight and obesity is occurring during the summer, and it's actually going down during the school year. So I think that year-round school would be great for that, and that would be a unique intervention. Yeah. Yes?
Thank you for your presentation. I was wondering in the literature you reviewed, did they have a chance to contrast schools that were receiving this activity interventions versus those that weren't in terms of the summer trends?
So the question is, does the literature tease out whether or not there's physical activity interventions occurring in those schools, and how does that relate to their decreases in BMI during school? Was that?
During the summer.
During the summer. So the charts that I showed with the changes in the prevalence rates don't capture any obesogenic behaviors. They're just capturing the actual weight status of these children at the beginning and end. Whether or not there are physical activity interventions taking place within these schools, well, I would contend that PE is an intervention, recess is an intervention, before and school opportunities are an intervention in and of themselves. And if we look at the literature base, Metcalf actually had an article, I believe it's probably 2 or 3 years now, where it's a systematic quantitative review, where he looked at all randomized trials with using accelerometry as the primary outcome on physical activity, and across the board, the pooled effect was 4 minutes gain. And so our interventions are not having that much a change in physical activity. So I would say that the activity level that kids get just standard in schools is probably eliciting some of that effect of a decrease in BMI. And it's compulsory. Okay? You got to go to PE. You have to go to recess. Now, you can choose to opt out, but that's a fraction of the kids. Okay? So I think collectively, these compulsory environments are facilitating health behaviors. In the back.
Does your research and the literature and research base as a whole take into account students that are in general education versus special education? Because I imagine they have a lot of differences in their environments and their behaviors.
That's a really good question. The ECLSK has a restricted data set where you can actually pull out kids with disabilities, and whether or not that's a cognitive disability like a learning disability or an intellectual disability like Down syndrome. But you would have to ask for that data, but I'm almost certain that that's embedded within that 18,000 kid, the 2016 Paul von Hippel. And so I think that would be a really good secondary data analysis paper, and you contact Paul von Hippel and see if he's exploring it, and maybe he'd like to help you facilitate it. Yeah, I think it'd be good, because they do have it embedded. They have disability. It's just that it's such a small fraction of their overall 18,000 kids that they include.
Are you aware of any disparities in outcomes of the BMI and the other obesity indicators in general versus special education, or is it just not studied?
Nobody's reported that I'm aware of. And again, I think the reason that we have some of this data to show is that people just happen to have collected fall and spring BMI and then gone back and looked at and mapped it out and said, oh, wait, something's going on here, So I don't think that these were intentional to figure out the summer thing. It just happened to be embedded within their actual study design. Yeah, like the Shape Up Somerville. And maybe J.K. can...
The youth fitness data actually has a special Olympic in the special kids in special education versus non-special education, and we ran it, and almost very small differences there. Because the sample is about 3,000 to 4,000 people, so it's not that big. And student who receive special education is about 20 or 44, so it's not that big a difference.
But I think it's worth exploring. And that data already exists, you just got to get access to it. Yes?
Yeah, really interesting talk. It's a little terrifying as we come up on summer, too.
Yeah. Watch out. Well, you have a great summer program that kids can go to. Yeah.
What I think I'm really impressed with is in 3 months we have these huge gains, but then in 9 months of the school year we have kind of relatively minor things. And then as your pilot data indicates, there's no major patterns for that. But as you get into those data, do you see not just patterns, but is there something with a larger magnitude that you think might be driving that?
You know, that's a really good question, and that's something that we really can't explore because we just have such a small sample size, but that's something that we will try to do to say, hey, look, if you change your, let's say, moderate to vigorous physical activity by 10, 20%, does that offset negative gains in these other behaviors? And maybe we can kind of figure out like the sweet spots of these behaviors, and if you change them all by 5%, you get these great gains, and then if one tanks by 30%, from where you were relative to school, so I think that those are really interesting questions that I hope that our data set will eventually be able to pull out and explore. But yeah, it's a really good question.
Yeah, you led into what I was curious about, which is I realized that they're pilot data, limited numbers, but it seemed like you have bivariate analysis, right? Which is just, it was red or green.
Yeah.
Which is, do you think that that's, a problem right now in terms of how you're able to really interpret the data? Just because I was thinking, aren't most of them to some degree somewhat red, right? Isn't the idea that a lot of these things are changing negatively during the summer period?
Well, I think what that health behavior was that not all the kids are changing. Some of them had more sleep during the summer. So if we think about sleep as it relates to risk of childhood obesity, short sleep leads to a greater increase in the risk of childhood obesity. So if we're sleeping longer during the summer, and we can always classify longer as, is it 10 minutes, 20 minutes, 30 minutes. And so, yes, I do think that for an analysis part of just dichotomizing, yes, it has its limitations, but for just quick interpretation, I think that we can start pinpointing some things down, and then with a larger sample size, we can begin to explore, is it the magnitude of change in a behavior that is really driving it?
Yeah, and that was going to be my follow-up, which is, are any of those things that are just presented to us as red or green, or any of them changing with a greater magnitude that maybe wasn't visually?
Yeah, so we do have some kids that do change, like the screen time went up by like 200 minutes on average during the summer.
200
okay?
minutes per...
On average, across both samples from where it was during the school year.
But I guess like per day?
Yes.
Okay,
yeah.
That's a lot.
Yeah, and so, but again, if I'm doing that, but I'm getting better sleep, and I'm so in our sample, we actually had, so again, it's parent proxy of their dietary behavior. So the parents are reporting that they're eating more fruits and vegetables, but they also reported eating more of everything. And so it might be, yes, they have more fruit and vegetable, but they're also eating all this other stuff in conjunction with it. So again, it's not one thing or the other. It's how they're all going to interact, which I think that's the real interest here that excites me. Is like, wow, I'd love to have at least 200 kids, let alone 500 kids, to begin to explore this stuff. Yeah, those are very good questions, though.
What's your selection criteria outside of race for this upcoming?
Well, you have to be in a school that's high or low income, which is how our school district has gerrymandered who goes to which schools, and
so it's not singling out kids that have been labeled as obese or overweight.
No, we're hoping to get a good representation of weight classifications.
Okay, good.
But it's really predicated on, we have 4 income schools, which are predominantly white, and the other 23 elementary schools in the district are all 80% or more free and reduced lunch, predominantly African American.
I guess where the question is coming from is, you're not telling kids you are labeled obese, so we're studying you, right?
No, because we even see that the healthy weight kids or healthy weight classification kids are also increasing their weight at a greater rate during that 3-month summertime. So, but we will do subsample analyses to kind of tease that out. Is there differences with weight classification? Yeah. JK.
Like, I'm just curious about how you're not analyzing if that pattern is so everywhere and you don't see the commonality. How you attacking? How you analyzing that? I just am curious.
Yeah. That's good. So what did I say we were going to do? I think on a cross-sectional basis, we're going to do some latent profile analysis using M+.
Continuation needs to be there.
Yeah. So so I think we're going to have enough spread in our variables to be able to begin, or enough variance to be able to tease out, you know, kids that are really high. So if we make a change score between summer and school in terms of the behavior, on each behavior you get a change score, and then perhaps you can standardize them in terms of percent. So that way they're all in a common metric, and then those change scores can then be looked at for profiles for kids that are changing those things. So that's what I'm thinking that we can accomplish right now. But, you know, again, as we begin to get into the data, there could be alternative ways to begin to analyze it, to be looking at those patterns. But I think a latent profile analysis will provide us with some good cross-sectional assessments from school to summer differences and how that relates to the probability of being overweight or obese or gaining excessive amounts of weight, however we may classify excessive, like the upper third of the distribution or something. During one cross section, which is school and summer for a year. If you know of any other more sophisticated analyses, I'm open to them. But I mean, I was pulling into my sophisticated analyses bag, and that was one of the ones that I pulled out. And I think Alan would agree that might be inappropriate. Where is he? He should be here to back me up on this stuff. But again, you know, you can look at, you know, people have looked at hidden Markov modeling and looking at changes in these things over time and what's the probability of changing from one group to the next. And you could do that with these behaviors. But, you know, I think what I'm trying to do is make it something that's interpretable as well as informative, but also takes into account the complexities of these things as well. Mike.
Nice talk.
Thank you.
You hypothesized that all of this was due to a lack of structure over the summer.
Yep.
And I'm assuming different children will have different levels of structure within their home environment. I was wondering how you're going to go about measuring and kind of quantifying that and taking that into account.
Yeah, so that's a good question. So we have a lot of parenting-related practices, and that we have a whole host of battery of parenting things related to. Do I I'll have to go to bed at a certain time? You know, do I make sure in terms of our dietary stuff, you know, family meal times? So we have those things that are embedded within that. Now, obviously, those are parent self-reports. But I think that what we're going to see here is that in terms of structure, I think that it's more of the outside of the home kinds of things where it's in the care of another adult that it's facilitating that structured environment versus what's happening at the home. Because I think that the parents, and at least on our parenting data, they change their parenting-related practices during the summer. But consistent with what you would think, like I'm a little bit more lax on when my child can come home at night, you know. I'm lax on when they go to bed and when they have to wake up and stuff. So I think that parents, at least parents of children in low-income households, are probably not going to place a lot of restrictive components on their child when they're at home unless they are forced by some external factor like a school that they then have to subsequently get up and go to. And so I think that's really what the key here is. And we know that some of our kids are going to go off to summer day camps. But if we look at at least what the National Summer Day Camp, I think it's called the National Summer Day Camp, the guiding organization for summer day camps, they estimate about 14 million kids annually are attending summer programs. Summer program is of some sort. But that's only 20% of kids. And most of those kids are of high income because it costs about $100 a week to send your child to summer care, and that's a lot of money for these families from low income. So I mean, if you're living in a household with 3 or more kids, and you're single, and you have less than $20,000 in disposable income, I mean, so I think there's an access barrier there. And apart from year-long school, I think that if we just gave kids vouchers to go to summer day camps on a regular basis, that would mitigate these unhealthy weight gains as well. So I think that these settings are already really beneficial. Individuals from low-income households just have restrictive access to them. Yeah, so good questions. Karen.
So good to see you. Thank you. I'm going to pitch and a question. So I have kids in the summer, if anybody's thinking about looking at this. And Kathy found out that on average, our kids at Kid Spirit walk 3 miles a day. So just know that we're a resource. And I'm not a researcher, I'm a programmer. But I have kids. But my question is about the age group. So you're doing through 4th grade, and what I'm finding in my programming, that the through 4th grade, they're willing to be active and do all this stuff, but all of a sudden those middle school kids, they just are begging me for sit down talk time, and this is too much food, hang out, and are you eventually going to look at that social
The idea
change?
is if we get funded on this, then we have the continuation that continues the cohort on. But I think what you're describing though, so let's say their physical activity goes down during the summer, but I bet you they don't have unrestricted access to foods and other things. So that's where I think it's these patterns where, yes, maybe their activity, I want to sit down and hang out, but I'm not snacking or going off to the, doing Borden kinds of foods, which actually may be so it's still that structure. So you have a restrictive environment. You don't have the compulsory component of getting them to be physically active, but you have the restrictive component that unless they're bringing like a cooler full of snacks with them. And I think some of your kids, I've seen them actually do that, but not all the kids. And I've seen some of your kids eating sushi during the summer as well. So I think that restrictive nature may offset those declines in activity if it's lower than what they would be getting during the school year.
Because we have to be really plan that social time, then okay, let's go.
Yeah, and if you look at the history of studies looking at changing at least physical activity in middle school and beyond, we just have been notoriously unsuccessful. Dr. Flay.
One point in the question.
Yeah.
What we've called the sawtooth effect occurs with multiple problem behaviors as well. Substance use, violence, all those things. You can improve them during the school year and then get worse again during the summer. So it's all kinds of behaviors. This is sort of an aside. What's the relative influence of the 4 or 5 factors that you say are important correlates, predictors of weight gain or BMI?
So if I was to add them all into the model, what proportion of variance in the change of BMI would they each account for individually, controlling for the other? I think that, I think if I put on my physical activity hat and I would say, oh, it's all physical activity and, the diet stuff. In fact, you walk around the Department of Exercise Science at USC and you'll see that our diet stuff is pretty dismal. But, and so I don't know. I mean, I think that therein lies the crux that we don't know, is it just one of these behaviors that's really driving it? And one of them is more important than the other. I think we all have our pet behavior that we'd like to have be the one. I think they might have a lot of, I think they all might be accounting for the same proportion of variance, is what I'm going to say. Although Javier would say he wanted to be sleep, right? And who's the dietitian in here? You got a dietitian? And so, I don't have a good answer. Everybody's really looked at that in terms of that accelerated change and all of those health behaviors in the same model.